Let's talk about fever. Get used to the idea your child is going to have a fever. And in fact, I believe the average is 7 febrile illnesses, 7 fevers over the course of your child's first year of life. So this is part of what happens. You need to know what is a fever. What is the definition of a fever? It's defined by a temperature of 100.4 or higher. That's the definition of a fever. So that just means that your child's body temperature is set higher, it's going higher, than what would be a normal temperature. When you take your child's temperature to see what their temperature is, you need to use a digital thermometer. Many of you got them in your baby shower, or you got them as part of the gift that you went home from the hospital with, or someone brought one to you. But a digital thermometer is very important. If you're looking for something as accurate as 100.4, you want to have something that reads the number out to you. And the digital thermometers are very, very accurate. You don't want to be using things like the tape that people will sometimes put on a child's forehead that gives you a number. That's just not accurate enough at all. You don't want to use the ear thermometers. They're kind of cute, but they don't give you the accurate temperature that you really need to know in a child. And you don't want to use a mercury thermometer. I happened to find one of these this morning when I was actually kind of going through some drawers. This is something that some of you are young enough, you may have never seen, but this is a mercury thermometer, where inside of this is actually mercury. The problem is if I were to drop this and this were to break, that mercury would actually end up in the air, or a child can actually pick it up and eat it, and this is toxic. Very toxic. You can't find these anymore. This is an antique. I'll have to keep it and try to sell it on eBay or something, but those don't exist anymore, and you don't want to use them if your grandmother happens to give you one, because they have one around the house. Now, if you use a thermometer, what we really want you to do is not just, if you use that digital thermometer, where do you put it? Well, you put it in your baby's bottom. That's the most accurate place to get a temperature, to check and see if they have a fever, and that's just the place it needs to go. The question is, how far in the baby's bottom do you need to put the end of that thermometer? If your child is 6 months of age or less, it goes in about the diameter of a dime. So it's about a half an inch deep, and sort of something every day in your life that's about a half an inch in diameter is a dime. Not on edge, but on its sort of width across. If it's an older child, so a child over 6 months of age or so, you want to take a quarter out of your pocket instead and use that as the depth that you put in. And again, the goal is not to measure what the little cheek's temperature is. You want to measure what the temperature is inside the rectum of your baby. And you can, again, a dime for 6 months of age or less, that's how deep it goes, and a quarter depth. Don't use the quarter in there, use the thermometer in there, but that's the depth that you want to put it in.
So the vast majority of time when your child has a fever, it's going to be caused by infections. And the vast majority of that, it's going to be a virus causing the infection. Things like colds and the flu. Now, viruses, there's no really treatment for them. Antibiotics don't work. You just need the tincture of time. Your body's own kind of healing process is going to make the viruses go away. So again, antibiotics don't help viruses. They don't kill off viruses, and they don't help resolve these infections any better than just kind of Mother Nature and time. So fever is related to infections. It's basically a sign that your body's fighting the infection. It actually brings on a lot of good benefits to the body. There's some debate about whether or not we even need to treat fever. So again, fever is not a disease in of itself. It's a sign that your child is fighting an infection. The vast majority of the time, the infection is a virus, and antibiotics don't help viruses.
They don't. Unfortunately, they don't. We would like them to, but they just don't.
Right.
Now, there are some of these infections, Maureen mentioned most are viruses, but some truly are bacterial. Some do absolutely happen from bacterial illnesses. The most common kinds of infections that are caused by bacteria, some are chest infections like pneumonia, although I will tell you a lot of pneumonias are viral in nature. They're not from a bacteria. Or middle ear infections, where that's actually an infection behind the eardrum. And these days, most of those are viral. So even those aren't bacterial a lot of the time. And then urine infections are bacterial. Urine infections, particularly in little girls under the age of 2 or uncircumcised little boys, they do tend to be from bacteria themselves. And that is the kind of infection, the bacterial infections, where antibiotics may actually have some help. Fevers help fight infections. The reason that, why would you even get a fever in the first place? Well, it's because your body, when you get one of these infections, knows that bacteria and viruses don't grow as well if it's hot. So they ramp up your temperature, and the bugs that are in there, the infections, don't grow as well, the things that are causing the infection.
And when a child is actually brought to the emergency department or to a pediatrician's office with a fever, it's going to be the physician's job to basically evaluate the child based on the age of the child and the level of the temperature, and looking for what we call as the source of the fever, deciding whether or not they think it's a virus problem causing the fever or something that's a bacterial problem. They may do things like urine tests or a chest x-ray, again, depending on
or they may do nothing.
The evaluation, or they may do nothing based on the evaluation of the child at the time.
Yeah, the fever is not a disease.
Right.
The fever just means we need to look to see what's happening.
It's a sign that your body is fighting an infection. Now, early on in a fever, in the first couple of hours, even the first day, it can be very difficult to tell the difference between this could be a virus or this could be a bacterial problem, or even if this could be something serious. The vast majority of the time, the fever situations are benign and not serious. But every once in a while, it could be a more serious situation. So if your child has any of the following signs, whether or not they have a fever, but especially if they have a fever associated with it, you need to seek immediate medical attention. And those things would be things like lethargy, or this profound sleepiness, just a lack of energy, this listlessness. The child looks pale to you at all. Or if the child appears to be in pain for any reason associated with fever, that child needs to seek medical attention immediately.
A couple things can happen in addition to just the fact that your child may have an infection causing a fever. In some children, they can develop a condition that we in medicine call febrile seizures, which just means that a seizure that's caused by the fact the child has a temperature in and of itself, not that there's any bad infection causing this, just that the fever alone can cause your child to have a seizure. Now, a seizure basically is your child having rhythmic body movements. You've seen them on television or you've heard about these sorts of things. What tends to happen is your child may look a little strange, may stare off into space a bit and look very still, and then suddenly develop jerking of their arms and legs and after they stiffen and roll their eyes. And it's actually, I have to tell you, we've seen these in medicine. We know what's causing them, and we don't tend to be as alarmed. But as a family member and as a parent,
it can be terrifying.
It is terrifying. But the good thing to know about this is that it is rarely, virtually never, something that's serious for your child. If it's truly a seizure because of the fever, and that just happens in some kids and it runs in some families. You may find that you had those when you were a child.
Right.
Your mother may say, oh yeah, you had those when you were a kid too. They tend to run in families, but they don't cause permanent harm. There's no paralysis, there's no brain damage that occurs, there's no nervous system problems. Nothing happens specifically from the febrile seizure itself. So although it's an alarming thing to see, and we'll talk about that, you want to bring your child in for care, most of the time your child is just fine.
Right, exactly. So what if your child has a seizure? And the funny thing is, a lot of times the parent doesn't even know the child's sick, right? The kid hasn't developed, maybe the kid has a little bit of a runny nose, but doesn't really feel like they have a fever yet. Mom takes the child to the supermarket, and all of a sudden the kid has a seizure in the produce aisle. And the paramedics get rolled out, and they take the temperature of the child, and it's 104. So a lot of times it's before the parent even knows the child even has a fever. If your child has a febrile seizure, if your child is actively having a convulsion in front of you, the first is you want to make sure that your child is safe. Put them on a bed, put them on the floor, make sure they're not near anything like a hard object that they could bang their head into. So make sure that they're safe. Roll them on their side, because occasionally kids will drool when they have a seizure, and you want the drool to come out and not kind of roll back into their lungs. So roll them on their side. Don't put anything in their mouth. A lot of people think there's a myth out there or a belief out there that you can swallow your tongue when you're having a seizure.
Which
it's impossible to do. You cannot swallow your own tongue. So roll the baby on its side. Make sure that the child is not going to be in harm's way on a mattress or on the floor. Don't put anything into the child's mouth. And the vast majority of febrile seizures only last a minute or two. If this is going on longer, your child is continuing to seize, go ahead and call 911. But the vast majority of seizures are only going to last a couple of minutes, and then your child just needs to get evaluated as to why they have a fever. So go to your pediatrician's office. You're welcome to come to the emergency room too.
And we'll check them out and see why they have the fever.
Exactly.
Other things that can happen with kids that have fevers is they may have some respiratory distress, and actually you can see respiratory distress that has nothing to do with the fever. So if you happen to have a lung infection or an airway infection that's causing them to have a fever, they can have respiratory distress with that as well. Now, what is respiratory distress? Well, it just means your child is having difficulty breathing. There are signs for you to know your child's having trouble breathing. You know what your baby feels like when they're breathing, and if they feel like they're breathing faster, well, you're the parent, you know that. So if it's faster than normal, that's a sign that your child may be having some respiratory distress. If they're wheezing, you've heard that. You can watch TV shows or seen movies where people are wheezing. It's a high-pitched sound that comes while your child is breathing. That's abnormal, and that may be a sign of respiratory distress. Difficult or labored breathing, where you kind of have ramped it up and they're actually even sicker.
They're working to breathe.
And it
Yeah.
looks like they're working. You will see their nose, their nasal, sort of the nose flares a bit when they're trying really hard to breathe. Their breastbone will suck in when they breathe. Between the ribs will suck in when they breathe. And sometimes their tummy will come up to help them try to breathe as well. It's pretty obvious when these all occur. It's not a subtle thing. The kids are working very hard to breathe when they do this. And if your child has frequent coughing spells, particularly if they cough and cough and cough and cough and turn blue, or cough and cough and cough and cough and throw up, they're having trouble breathing. They're having something that's causing them to have respiratory distress. Those are all things to consider, either calling your pediatrician or bringing your child to the emergency department.
And I always commend parents who notice these things in their kids, that the child is working harder and sucking in to breathe and the belly is going, and the parents are really paying attention, and that's what prompted them to come seek medical care. So I always commend parents, Mom, you did a great job. This was exactly when you needed to bring your child in to get care. So urinary tract infections are another reason that young children can have fevers. And they can be a significant source, and they're definitely bacterial infection. Your child, if diagnosed with a urinary tract infection, is likely to get antibiotics. The signs, though, can be fairly subtle sometimes. So things you want to look for that may make you more worried that your child has a urinary tract infection include if your child's urinating more frequently, if your child seems to have discomfort or cries when they're urinating, or if their urine from the diaper just smells funny. Those can be signs that your child has a urinary tract infection. Now, certain children are more at risk. Girls are more at risk just because they have a much shorter urine tube to pee out of. So they're just more at risk for having urine infections. And then little male babies who are uncircumcised, they also pose a much higher risk for developing urinary tract infections. One thing you can do with little girl babies to help them decrease the chance of them having a urinary tract infection is when you go to wipe them, when you're changing their diaper, really wipe them from front to back, from the front to the back end. That way, if you wipe the other way, you're really wiping sometimes feces and other things across the area where they urinate, where they pee from. So you really want to take the wipes and go from the front area to the back area. And when young girls are learning how to be toilet trained, that's something you're going to want to teach your young daughter, is to wipe from the front to the back.
Right.
And that will help decrease the risk for urinary tract infections in young girls.
Right. So when you're changing a diaper and you use the wipe, just make it a habit to just go front to
Wipe
back.
down.
Just top down,
Right.
instead of from the back up.
Exactly.
As far as the fever, when should you worry? When should you call your doctor? When should you consider coming to the emergency department? Know again that fever in and of itself isn't a disease. It's caused by children getting an infection. So when your child, now the biggest group we worry the most about is the teeny tiny kids. So if you have a child that is 2 months of age or less, and your digital thermometer that you put in just the depth of a dime's distance comes out and it says 100.2 or higher, you're going to call your doctor. And your doctor will tell you this. Your pediatrician on your first well baby visit will say, I want to know if your child has a temperature of 100.2 degrees or higher. If your baby's 3 to 6 months of age, we kind of ramp that up a little bit. And 101 degrees is where we say, give us a call. Let's talk about it and see what might be causing the fever in your child. And then the older kids, where you get a kid over the age of 1 or so, and definitely over 2, their temperature over about 103 is where we want to hear from you. Now, you call your pediatrician. You don't have to come to the emergency department, and they may just chat with you on the phone. And say, how do they look? Sounds fine. Treat the fever. We'll see you later. But that's when you really want to get in contact.
Right.
Again,
I think the key point here is knowing that the younger the baby, the lower the temperature that we care about. Older kids, we allow more of a fever before we become excited, before we're going to want you to call your pediatrician or come to the emergency room.
But it is particularly important in the little tiny ones to get a hold of your doctor.
Exactly. So if you've followed the advice to know when to go see your doctor, there's some, and your child's acting pretty well, there's some evidence that we probably don't even need to treat the fever. Treating a fever is not going to make the underlying illness that's giving the fever, whether it's a virus problem or a bacterial problem. Just treating the fever itself is not going to make that infection go away any faster. So again, if your child seems comfortable, if they're eating and acting normally, some people could argue, why should you treat the fever in the first place? I always say if you have to chase the child around the room to give them the acetaminophen or the ibuprofen, they probably don't need it. So again, a lot of times we give fever medications in order to help a child, to make them less dehydrated, because now they're going to feel not as cranky and they're likely to take their bottle. They're not going to sweat as much. They're not going to lose fluids. That's the reason that we're giving kids treatment for fever.
Right, we worry much more
not
about
to make
how
the illness
how
go
a child
away
looks
faster.
than we do with the
Exactly.
number per se. Except for the little tiny guys, again, where the number is really important. We worry much more about how your child looks. The temperature
Right.
itself actually is not as much of a concern for those of us that take care of these children.
Right, but everybody feels uncomfortable when their temperature is really high. So the real reason to give a child a fever medication to bring it down is to make them feel more comfortable. So they feel comfortable. They're less likely to be cranky with you, and they're much more likely to take fluids when they're less cranky.
A couple of quick other things you can do to help with your child's fever. Keep your child's room cool and dress your child lightly. The temptation is, and your grandmother may tell you, well, we used to swaddle you up when you had a fever to help you sweat out the fever. That doesn't work.
Yeah.
That actually makes them miserable. So don't
worse.
swaddle your child. Keep the room nice and cool. And you might even want to consider using something like a room fan. My recommendation on that, though, is if it's something with the blade, like a box fan on the floor or a fan that you can put on a table, make sure it is well out of the reach of any child so that they can't get their little fingers stuck in those. A ceiling fan is fine. And don't blow directly on the baby. Just keep that air in the room circulating so that nice cool air can circulate for your baby. Make sure the fluids, that we talked about dehydration, plenty of fluids, and you know how you watch them, make sure that they get plenty of fluids taken in there. And sometimes some babies like to be sponged in lukewarm water. It's water that's just warm to touch, not cold water, but just warm to touch, and they like it. They can get sort of this tepid water put all over them. Some babies hate it. So gauge your child and see. Some children really don't like it, but some children it actually makes them feel better when they're hot.
If they're having fun, let them do it. Yeah, but if it's making them miserable, you don't have to do it. So again, there are over-the-counter medications that you can buy, acetaminophen and ibuprofen. They both work very, very well. Kids who are less than 6 months of age, the advisement is really to contact your physician before you give your child any medication. Now, some physicians and some parents, and even some children are going to prefer one medication over another, but they both work equally well in well-hydrated children. And with any medication, you want to make sure that you follow the label instructions on the bottle carefully.
Give the right dose. And
right.
most of the failures that we see are parents giving the wrong dose, particularly because between the last illness, which was a couple months ago, and this one, your child has grown tremendously, and that same dose doesn't work. So always check the instructions to tell you how much to give.
And we will ask you that when you come to the emergency room or to the pediatrician's office, exactly how much did you give, and we'll be looking at the child's weight and making sure that you've given an appropriate dose. Because again, the vast majority of the time, you're just not giving enough for the acetaminophen or the ibuprofen.
If it doesn't
to
work, it's often not the right dose.
Underdosed, exactly.
Now, the ways to make sure you give the right dose is always dose with whatever the dosing product is that they put in with the package. So whatever came with the package that says give this much of this to your child, that's the one you want to use. I'll tell you what you do not want to use is a teaspoon in your kitchen.
Right.
The teaspoon in your kitchen can have anywhere between half as much dose as you should give to 4 times as much dose as you should give. So don't use a teaspoon. You can use what came with the package as the dosing way to give, little product to give the dose to your child. You don't really want to alternate these medicines. Some people say you don't need to. It makes things kind of complicated. Stick with what works. Give the right dose. And what you do not want to give is aspirin. Aspirin in children, especially children with certain kinds of viruses, is associated with a syndrome called Reye's syndrome, which is extraordinarily rare, thank goodness, mainly because we're no longer giving aspirin to our kids. But it's something that can be caused by aspirin in kids that have viruses. So just no aspirin in kids is just the rule across the board. Stick with your acetaminophen and stick with your ibuprofen, and that should take care of their temperatures.
Pick one drug, make sure you have the right dose, and you'll see that it works. Exactly.